Bismillahirrahmanirrahim. Assalamu alaikum. Only recently, couple of days ago, a new molecule, Tirzepatide, has been launched by one of the national company here in Pakistan. And with this launch, many colleagues of mine who asked me about this molecule, this drug, that what is it, when it should be used, what are its dosages, what's its efficacy, and what are the side effects, and what is the protocol where we should use this drug. Already we are having semaglutide with us. This Tirzepatide has been in a clinical practice out of Pakistan, but now we are lucky enough that we have got this molecule, and now the colleagues, especially the junior ones, they have asked me these questions. So in today's lecture, I would like to share my thoughts on it and try to answer these simple questions, the basic questions, that what is it, what's the dosage, what's its indications, and how we can better use or use it in a best way to our patients. Bismillah ar-Rahman ar-Rahim. As mentioned in the intro, topic for today's discussion is Tirzepatide paradigm shift in the management of metabolic dysfunction. Tirzepatide is an injectable medication which was developed by Eli Lilly and marketed under the brand name Mounjaro for type 2 diabetes. And also it's being studied and used for obesity management under the brand name Zepbound in some regions. And only recently, couple of days ago, it has been launched by our national company here in Pakistan as well. So many questions I received from my colleagues, especially junior ones, and I'm trying to answer those. So the first question is what it is. So Tirzepatide is a dual GLP-1 and GIP receptor agonist. So it's a dual receptors agonist. GLP-1, that is the glucagon-like peptide 1, and GIP, that is the glucose-dependent insulinotropic polypeptide. These are natural gut hormones called incretins that help regulate blood sugar and body weight. Tirzepatide mimics both of them, making it the first dual incretin drug of its kind. When it should be used? In type 2 diabetes, it improves blood sugar control, reduces the HbA1c levels when diet and exercise alone are not enough. And FDA approved this for type 2 diabetes in 2022. Then it can be used for obesity and overweight people. So it has been approved in some countries for chronic weight management in people with obesity or overweight with at least one weight-related conditions. It may be hypertension, sleep apnea, or diabetes, and FDA approved this for this indication in 2023. And investigational, its use is that its potential benefits are being studied in fatty liver disease, muscle and MASH, cardiovascular risk reduction, and more. How it works? Tirzepatide increases insulin secretion when glucose is high. It decreases glucagon release and thus lowers blood sugar. It slows stomach emptying and thus promotes satiety. And it reduces appetite, leading to significant weight loss. So on one hand, it improves blood sugar levels, improves HbA1c, and on another hand, it burns out the obesity as well as its complications like cardiovascular diseases, sleep apnea, and MASH and MASLT. What is the dosing? How should we use it? It's given subcutaneous injection once weekly, just like semaglutide. And just like semaglutide, we use incremental dose. We start at low dose, 2.5 milligram weekly, and then gradually increasing up to 15 milligram weekly to improve tolerability and efficacy. What about its effectiveness? How effective it is? The clinical trials SURPASS and SURMOUNT show greater blood sugar control and more weight loss than existing GLP-1 agonists like semaglutide and Ozempic. The average weight loss in obesity trials were 15 to 22% of body weight, depending on dose and duration. What are the side effects? The common side effects, are the GI upset, including nausea, vomiting, diarrhea, and constipation. And there may be some serious complications like pancreatitis, cholelithiasis, and rarely ileus. And it's really contraindicated if there is personal or family history of medullary thyroid carcinoma, MTC, or MEN2. So in these conditions, it is contraindicated. And warning is that there may be a risk of hypoglycemia when combined with sulfonylureas or insulin. So these are the four main components: the common side effects, serious side effects, contraindication, and warnings. When we compare with semaglutide, what are the results? Both are the tirzepatide and semaglutide, both are powerful GLP-1 based drugs. We know that. But tirzepatide acts on two receptors, GLP-1 and GIP, giving stronger weight loss and glucose controls in trials. Side effects profile is similar, but nausea can be a bit more frequent at higher doses, that is 15 milligrams. So the clinical pearl of today's discussion is that tirzepatide represents a paradigm shift in type 2 diabetes and obesity management, with efficacy approaching bariatric surgery in certain populations. So thank you very much for being with me. I tried to answer those few questions which were asked from now till the initial 1 week or that after the launch. And I wanted to give the simple, crisp, and short answers so it helps you out in your clinical practice decision making. Thank you, and see you in another vlog on some another topic. Khuda Hafiz.